Good evening, everyone. We're just allowing some time for everyone to come in to the Zoom. Please take this opportunity to pop your heat packs in the microwave for a couple of minutes, get cups of tea, get a notepad, and yeah, get ready to let's collaborate and work through some navigation of healthcare plans this evening. I will also mention that we do have the chat working this week, which is really good. So we'll be calling upon you to pop in the chat there too. We're seeing some really familiar names, which is also really awesome. So we're just going to give people a couple more minutes to go through, and we will kick off at at 6:35 p.m. So that will give those people, I can see them all coming through the webinar now.
Hello, everyone. It's our final webinar. Now, in the chat, can you just confirm that you can hear me and you can see me and you can see the screen? That would be really helpful. We can get utilization of the chat going so that I know that you are there and that you can hear me. Oh, Lana has her hand up. Don't know how to fix that. If the chat's not working, the Q&A is there as well. So chat is disabled. Okay, cool. All right. Well, I'm assuming that you can hear me because you're popping that in the Q&A. That's great. Ash will work in the background to help sort the chat out, which is really good. Okay, all right, let's get into this. So this evening, we are talking about the final webinar for this series, which is all about creating that navigation plan. And really, what I want you to have or leave today with is some tools on how to navigate this all. So we will get into it. And as always, we really welcome your questions and your comments in the chat. So I'd like to acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. Pay my respects to any past, present and future people who have walked and cared for the land, and we acknowledge and respect their continuing culture and the contributions that they've made to this country. I'd like to acknowledge everyone here that has a lived experience, and also the significant others who have walked along this journey with us as people with lived experience. And acknowledge that the many leaders, tribes, people, organisations and advocates who have spoken about these issues, endometriosis is not a new condition, it's a newly spoken about condition. I like to say that because it's just not something we've, all come up with in the last few years, right? This has been long term. We know people, some of you in the room here has probably suffered for decades. So it's important to acknowledge that. And because of the people that have spoken for many, many years, we build on their legacy and their dedication and their advocacy that has preceded us, preceded me. I just want to acknowledge that. And gosh, it would have been bloody hard back then. It's hard now and it would have been harder. So just acknowledging there's a lot of work that has been going on in this space. And we're here because of that work. So this was so useful to know last week. I want to know a little bit about you. So drop a light bulb if you're here to support someone going through navigating the healthcare system. Drop a hands emoji if you're a partner, friend, manager, or someone, a loved one learning to walk this path with them. Drop a headphone if you're here to learn and listen with empathy. A rainbow if you're showing up to make your workplace, home, or relationship safer for this conversation. And a thought bubble if you're the support crew, because we see you too. So can you please pop them in the webinar chat? So again, I can understand who we have in the audience here. It's so cool to see a lot of familiar faces and familiar names. So really welcome your contributions tonight. Qendo is a nonprofit organisation and we have been supporting people since 1988. So before my time, what I call bra burning women advocating for endo and adeno to be spoken about. And we now are at a stage where we offer free services 7 days a week, 365 days a year. Even on Christmas Day, I remember taking a crawl on Christmas Day. And we do this through mentor program, nurse navigation, our webinars, our app, with so many things. And we do this with partners with people like the Brisbane South PHN and Queensland Government and the federal government through programs. And we work to ensure that there's culturally safe, health literate, and evidence-based information and programs out there available for people. Our goal is to ensure people, especially those who are marginalised and who face additional barriers, have access to care, information, and support that we all know that we need to navigate chronic and complex conditions, and that is endometriosis. So, if something that I say tonight hits home, please drop a heart. If something clicks or feels helpful or you feel seen, please also pop a heart in the chat so I know that it's making sense. When you're delivering webinars, it can be really tricky to know if this is making sense because you don't get that feedback in the room from people. So I'm calling on your partnership tonight in learning and listening, but also giving me some feedback of, is this landing? Is this making sense? I would really find it so helpful and so useful that if you can contribute that back to me. And if you are taking notes, please pop a little emoji that signals that too, because it's really useful to understand if it's making sense, like I said. Not only does it help me know what's landing, but it reminds others in the Zoom here and online that you aren't alone and we are not alone in this. And sometimes just dropping a little heart when you feel seen will help another person to realize, yeah, I feel seen too. That would be great. Okay, so this has been brought to fruition because of the Brisbane South Primary Healthcare Network, who are a Brisbane South organisation that is federally funded, but they work in partnership with health professionals and communities to improve health outcomes for everyone in the region. And so with the support of the program and the grant, we have been able to pull these together as well as some additional guides. The Health Literacy Hub launched earlier this week. I think we're still in the same week that we held another webinar. I don't know, it's all been a bit of a blur. But we have launched the Health Literacy Hub, and the idea behind this is that people who are facing challenges in the healthcare system and access can go here and find lots of different resources, including resources in 9 other languages. And as we start to grow and contribute and build out additional resources, we have them in over 150 resources now we do have, but not all of them are in different languages, but a lot of them are, and this is where you can access them. You can also access workshop 1 and 2 here as well, and that will get you started if you did miss them. So I would encourage you to head there. So what are we going to cover tonight? We're going to talk about what to bring, what to ask, and how to prepare for appointments. We're going to go through the brain's decision-making framework. That was a bit of a recap. We'll go through that too. We have language tools for talking about chronic or ongoing pain, how to advocate for second opinions, continuing care and follow-up. And we've got some tools with those with English as a second language that we have learnt from our consumers and our people in our community to share as well. And also would really welcome you to share a little bit about you in the chat too. If you can't access emojis, it's also really helpful for people who aren't on the Zoom here live. It's being recorded, and I will talk about that, about why you're here, what brought you here, what challenges have you faced. And that can also help people watching the recording to feel seen and heard and understood too. So what is a personalised navigation plan? So it's a practical tool to help support you on your healthcare journey. And the idea is that you utilise this to help feel prepared and feel confident. And I often call it the game plan. So whenever I'm interacting or encouraging people to interact with the healthcare system, I want you to think about, right, what's my game plan here? That is a really different space to come from compared to going in there in often what we can really feel is like a helplessness position. We really feel that because we want answers and we just need help, absolutely. But it's a lot to navigate these healthcare systems. And what I would encourage you to do is think about, what do I want out of this? We spoke earlier this week a lot about you employing your team employing your healthcare professionals as team members. And so we need a bit of a game plan when we go into that. So last week, or no, sorry, it was earlier this week in the last webinar, we spoke about working through this plan around what are my goals, what are my values, what are my deal breakers, and what do I want to get out of this. And so what I'd encourage you to revisit now, we did a bit of work on this earlier this week, is what are your current symptoms or conditions? So if you would like to get a pen and paper out now and in your own time, think about what are the current symptoms and conditions and challenges that you're facing right now, and start to work through what that might look like. So if you're open to sharing some of your current symptoms or conditions in the chat, that would be really helpful too. So we know that what you're facing, and I might be able to pull out some examples or some navigation there as well. You might not be able to see other people's responses in the chat, but I can call them out. So we've got people here saying that they are experiencing sciatic nerve pain and that they are experiencing pelvic pain, which is a common one. They're experiencing some form of bloating as well. Giving you a moment now just to pop any of your other symptoms in the chat. Hip and back pain. That's a common one. Often it's radiating down our legs, isn't it? And so when you're thinking about that now, once you've written down some of your symptoms, some things like bladder pain, back pain, hip pain, like we've heard, and people here who have suffered with pelvic dysfunction. So when you're sitting there thinking of your symptoms and your condition, I'd encourage you to think about the next question being, okay, what care do you need more of? What care do you need to support the symptoms and the conditions? And that might be, as someone has said, finding a good doctor who actually knows what they're talking about. People are saying that they feel like they have brain fog and dizzy and belly pain and diarrhea. Okay, so what sort of care do you feel you need? You might need to support each of those things. And the next question I'd encourage you to think about is, well, what is working now for me? What is working in the space for me? Is it that I do feel better after seeing a pelvic health physio, or I do feel better after eating a low inflammatory or no gluten? What's working well for you now? So if you write that down and have a bit of a consideration and a think. People are saying that in order to have the care that they need a doctor who will listen. And a lot of the conversations that are coming through, or the comments, are the first step of needing to find a doctor who will just listen and take action. Absolutely. Absolutely. It's often what I describe as this corridor where when you find a health professional who listens to you and is willing to take action, it's like a corridor hallway, and all of a sudden these doors start opening and you can go into these different rooms and try out a different thing or a different tool, and then come back out and try something else. And that's what a good health professional can help you do, is open rooms. And then my other question for you is, okay, well, we've thought about the symptoms and conditions. We've thought about what care do you need more of, and what is working well now. Can you tell me what's not working well? What isn't working well for you right now? What are you coming up against? And again, writing them down or popping them into the chat, so I can share, as you can tell, anonymously, what people are experiencing and what people are sharing here this evening. Someone has said in the chat that high cholesterol is another one that people are experiencing and didn't realize that it could be endo-related. There's high inflammation that people are finding not really working, not having enough education on what's happening with me, the fatigue. Yeah, these are all really, unfortunately, common things that we hear all the time. Okay, so that's a little exercise that you can come back to, and this is what builds our needs. And I really want you tonight to be as specific as possible we think we think people can read our minds, or we think different health professionals know what to do, and then we can get really frustrated when they just simply don't. And so tonight, from the perspective of you being the controller of your health and confidence in your health, and if you don't have the confidence, that's what we are here to help you with. um, I want you to really think about, what are my needs, and be very specific. So when you're saying or writing down things, I want you to go deeper and go deeper. Okay, this is my symptom, pelvic pain. Okay, where is your pelvic pain? Is it in the one spot every single time? Does it radiate out into other parts of the body? When is it in my cycle? Is it around ovulation? Is it around after having a sexual intercourse or intimacy? Or am I bloated around here or here? Please, if you can, open up to be more specific as you possibly can, because we want to, almost like the onion, unravel all of the symptoms and the mix of symptoms that we're experiencing. So this will help us to be really direct and really targeted in how we're communicating with health professionals to get ultimately what we do need. So a little bit of a revision. Who might be in that team? Who might be in our healthcare? And what tools might they have, and when do you engage them? So with endometriosis and pelvic pain, we have our medical team, we have the GP, the gynecologist, other people like the urologist, bowel surgeons, thoracic surgeons, radiologists, radiographers, sonographers, all of those groups. In pain management, we have pain specialists, pelvic floor physiotherapy. Please, 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 if you take nothing away from these webinars other than knowing you all need to go and see a pelvic health physiotherapist, I'll be very happy. And it can cost money, yes. So go to the Manage Endo program, and we have recorded several amazing pelvic health physiotherapists to provide education. And if you need to see a pelvic health physiotherapist and you can't afford it, can you please email us so that we can try and help you get in to see someone? So there's some stuff happening in this space. And if you need to see a pelvic health physiotherapist or a psychologist or a dietitian or a nurse, please write to us, info@quendo.org.au, because we want to know about you and we want to support you to get those services. So yes, please know it's okay to reach out to us. Acupuncture has been really well documented for endo and pelvic pain specifically, and endo-related pelvic pain, or that combination. Pharmacy, they're so valuable. They've got so much information that they can talk you through. They can talk you through different medications and how they might interact with others. So utilize that group. They're an often underutilized group. And osteo again is another group that's really underutilized, and they really work in with multiple different parts of our systems. We have our muscles, our nerves, and our fascia. That's like a bit of a webbing that goes all around our body, and they can really help to unknot a lot of that in our body. People that have that back pain, or they might hold their pelvis differently or feel really out of alignment, osteos can do an amazing job at lengthening and stretching and smoothing out that fascia to help all of the other parts of our body do what it needs to do. And then we have naturopaths. And then we have managing the load, which I call that load. I'm sure we've heard that term, but managing the load really talks to all the things we walk around with, managing all the things, trying to understand, managing the condition, trying to work, trying to live, having a family if you choose to, study if you choose to, whilst actually living with these diseases and these conditions. So having a support network, a social worker, a nurse, a psychologist, a counsellor, occupational therapists. OTs are another really underutilized group in this space. OTs, they are there to kind of do the implementation of everything that you're trying to manage, really. They want to get you moving well and living well and have your quality of life improved. So they're a great tool. And I think the disability space sector utilizes them really well. And in the chronic disease, chronic pain space, we could really utilize them better. Movement. And you've probably heard me before. I want you to do movement that you enjoy. So walking for me, no, I hate walking. It's a strong word, I know, but I really dislike walking. I always walk along the path going, walking, doing a stupid walk for my stupid mental health, that meme. But I found something that I do enjoy, and that's Pilates and netball, and I love it. It's so fun. And that gives me all the feel-good hormones. So we want movement. Motion is lotion, moving your body. And if you're in a pain space, moving your body a couple of times in the day can be really, really useful. It might just be getting up to go to the letterbox. It may just be getting up from your desk. Keep moving. Exercise physiologists can help us to hold our body better. It can help us to walk better and exercise better in a way that is supporting all of our structures. Nourishment, we know from most recent research that endometriosis specifically, and pelvic pain comes into this too, is an inflammatory condition. So higher inflammation in the body will contribute to more symptoms and more severe symptoms. They're seeing a dietitian or a nutritionist, and again, a naturopath can help with that. And then our relationships, which can be really, really impacted by all of this. Yeah. And we're never taught actually how to communicate very well. Hopefully, tonight you get some tools on how to do that. But we're never given the diagnosis and talked to or told about all of the implications. We just kind of fumble our way through it with our family and our friends and our partners and then work. And oh, that's a messy place to be. It's a messy place to navigate. So, seeing a counselor who can be really practical, and psychologists again, and families and friends, and bringing your partners along. Sex and relationship counselors are wonderful. They can help the implementation and give you tools. And again, we want some supportive workplaces. We want all places to be supportive. And if you go to our website, qendo.org.au/workplace, I think it is work or workplace, we have guides and scripts and downloads and resources that you can take to work and utilize. So use them there. They're free and they're there to download. So what I'd like you to do now is I'd like you to download the app if you haven't. So our Qendo app is there. So if you are on Apple or Android, choose the QR code and download the app, because we're going to go through a section of the app that I want you to navigate. Really exciting news. We are redeveloping the app. So it will remain free, it will remain available, but we are doing a complete redesign, complete overhaul. The functionality will stay there, but it will be really user-friendly. So we just received some of the very updated bits and pieces today, and it looks so good. I'm so excited to share it with you. And that is because you, the users, told us what you needed to change, and every single bit of feedback that has come through the app feedback, I have personally read, and that was what implemented and developed the next stage of the app. So that what we're about to publish. So please download the app. Thank you for all the support coming in the chat. It's so cool. Yeah, so just know, truly, truly know, when you tell us something that you want to see or implement or update or everything like that, we hear it, and we so want to give that to you. So that's what we're trying to do. All of your data will stay in the app. Everything will stay. So it's the same app, we're just updating it. So you'll get an email that says it's time to update your app, or in the App Store, you can just press the update button and it will come up. But everything will stay the same. We're just doing an update. So it's the same thing. Everything will stay the same. You won't lose anything. And if something does happen, we have everything that we can reload or back up. So, just if you have problems, reach out to us. We are really here to help it be seamless. Okay, so I'm hoping that you have now downloaded the app if you haven't already, so that we can get into this. If you are in a flare, if you have a flare or a crisis, I want to share these steps with you. So in this button here, this is your flare button. This will record when you're having a flare. So if you have a calendar, or if you have, that view of the activity, this is your point in time that tells us, okay, I'm having a flare. Then you can come and say, yes, I'm having a flare. If you want to be provided some tools, how to manage it, or access or contact your team, you can do that here, as well as knowing your routine. So the toolbox we spoke about last week and the toolbox we're going to talk about today, pop that in here. There's medication, there's triggers, there's your history, exercise, food diaries, all of those types of things. You can upload and save them in here. So track when you're having a flare, because when you look at your calendar and it has the little icons on there when you've had a flare, that can help you over time to utilize the data that you're inputting about your own healthcare to doctors, to health professionals, and in the healthcare system, because you can show them, I'm having a recurring flares, or over the time that I've experienced, or here's my journal, this is what I'm experiencing. And so this is becoming increasingly more difficult. It's becoming more flares than usual. And that can be a really powerful tool. We hear from people all the time saying that the data that they captured in this, and they showed it in emergency, they showed it to their GP, to their physio, look, this is what's going on for me. And they've got the app on their phone and they're showing them. And that data point is the health professional can go, right, okay, that's significant. And also when we're in a flare or in a crisis, the last thing we really want to do is, we've got brain fog, haven't we? We're exhausted, we're in pain, we've got brain fog. Popping in, you have a flare is a quick, easy way to record it. And then you can go back in and add notes and add your journal and your symptoms. But it will be a way for you to access that. Thanks for the message about the 2 links on Quendo, Health Not the access, the program, and download buttons. We will have a look at that. Thank you for letting us know, Tonya. So the other one I want to share with you is the Flare Up Quick Guide. So this is a guide that we have pulled together with our amazing consumers, amazing community, where if you're having a flare-up guide and you're feeling unwell, this is available to download from the website. So you can scan the QR code there, or it will be on the Health Literacy webpage in the other languages too. Now, in this guide, you have things, and here we go. You have information about the guide. We have our quick check of symptoms. There's a chat through of how to build the toolbox. You have a printout here of the toolbox, and we're talking through the dates, the types or the tools that you're wanting to use, what symptom, and then again, a tracker of has it been helpful, and scaling the symptom 1 to 5 to see how significant it was, and trying to understand if that tool was helpful. Now you can use this toolbox checklist, and when you're in a flare, or when you're trying to manage one of the flare of a chronic condition, right? Because we have endo and pelvic pain, we have chronic conditions. It's constant, it's all the time. And we have a flare, and that is a flare up, an increase of the symptoms we're already likely having, or we're having new symptoms, right? And so that's really difficult to communicate, particularly in ED, because you're having a acute or new or short-term increase in symptoms of a chronic long-term condition. So we're having an increase in symptoms of a chronic long-term condition. And how do we communicate that? It's so hard. So using this toolbox checklist can help, and you can download it, and putting in your tools, your symptoms, and seeing if it helps, and taking it into emergency, or taking it to your GP. Here's my flare date. Here's all the things that I've tried in my toolbox. So here's the things from my perspective in showing up in this partnership. And every relationship or interaction we have a partnership approach. We're coming into it together. We want to get something out of it. The other person on the end wants to get something out of it too. That's okay. So what are you doing from your perspective? Well, I have my checklist. I have my toolbox. I've tried all of these things associated with my symptoms. Here's what helped. Here's what didn't. Here's the scale I'm on. And having that paper and showing them all the things you've tried can be really powerful. Here we have the guide. So there's a number of different guides on this in this document. There's guides for parents, for schools, how to prepare for an ultrasound if you're going for an ultrasound, how to prepare and down regulate that nervous system that we know is really impacted, and actually give you some tools to do that. So if you are in this flare moment, if you are having really anxious feelings, or if you're in a lot of pain, that guide there and the other subsequent guides give you step-by-step things of what tools and suggestions you can actually do in real time. So you utilize those guides there. They're available on the website, and you can also scan the QR code. Okay, how are we going? How are we going? So let's talk about preparing for appointments. So we've talked and we've jotted down our symptoms and what we have been looking at. So think about when you're putting down your symptoms, the pain levels, if you've had fatigue, your bowel motions, any bladder changes, any mood changes, or any bleeding changes. So when you're structuring how you're speaking with your health professional, we have SBAR, we have brains, and then when you're preparing to go into that conversation to emergency, to the GP, I want you to be prepared. Yeah, have pieces of paper. Have your piece of paper, write this down, and have that with you. So jotting down, like I've said, what you've been feeling, what pain levels, and doing it in that structured way. Your questions. I want you to think about what questions, what do you want to better understand, and what do you want to ask? So write those down before you go in so you don't forget. I have been doing this stuff for 12 plus years. And I had a recent experience where I needed to go and see a new gynecologist. And I'll just say that, gosh, it was humbling. I was sitting in that waiting room, and look, again, we teach people this, um, and it was me sitting in that room going, I'm really nervous. I'm really nervous. And forgetting all of the things that I wanted to say, wanted to ask, or what symptoms I've even been experiencing. And I remember sitting there feeling completely flooded, a little overwhelmed. It was a new gynecologist. They didn't know me, they didn't know my story. And I remember sitting there going, are they going to believe me? Do I need to get my scans? What part of this? And are they going to validate me? Do they know my history? What information have they already received to make up this picture of me? And so I say that to, I guess, hope that you feel a little seen, and let me know in the chats if you've ever felt any of that. That yeah, you can do this for years and years, and you'll still have the moment of, okay, how do I approach this? And when I was in that moment, this is how I came up with this list of things. Um, this is how I came up with okay, what do I need to do to feel confident? And since that time, even before then, we've formalized a lot of this now. So yes, it's a thing. So what questions do you want to know? What do you want to write? Write them down so you don't forget. Ash, I hope you don't mind me saying this, but Ash, a couple of months ago, had to go to a GP. And, we talked about all the things needed to talk about before we're going in to see the GP. And she came out of the GP, and I messaged her to see how'd she go. And, and I said, did you ask about this thing, remember? Which is, I hope you don't mind me, Ash, the biggest thing that you went in there for. And even Ash was like, oh no, I forgot that part. So it happens. Ash, pop in the chat if that's true, or come online. Tell us what happened.
Absolutely. I went into the GP. I was like, yep, Jess has reminded me, like, literally just before I've gone into the appointment. I didn't write it down. And then I've got to the end of the appointment and gone, I'm walking back to my car going, that was the one thing I was coming in for. And I totally forgot. Should have wrote it down. Didn't.
Yeah. So write it down. I know it's so simple, but this is why we want you to write it down. We will forget it. We get flooded or overwhelmed, and it just happens. Then write down all of the lists and the symptoms. And people have just popped in the chat. Yep, happened to them last week. Yeah, totally. Write down your simpler supplements and your medications and list everything that you're taking, including pain relief, hormones, or your natural therapies. And now on this toolbox checklist down here, this is often where people write them down too. But this is your healthcare plan, okay? If you need to go to a hospital or go to another health professional or the GP that you're not in, this is your responsibility to keep all of this information there, as well as all the therapies and medications that you're trialing. And then I want you to think about your concerns and be honest. What is worrying you the most? Is it something changing or is something getting worse? Now, I don't know about you, but I will put off going to see a health professional because of all the reasons we know. And I'm really usually going to the GP or a health professional when things are really bad. And I'm worried that they're not going to believe me, that they're going to challenge my suggestion. And I need to think about, okay, what's actually worrying me the most right now? What is the real issue that I have here? So write down those concerns so that you're prepared and you've had time to think them through. Bring your Medicare card, bring your referral letter if you're seeing a specialist, bring your test results and reports for previous appointments. Please always ask for a discharge copy in paper or emailed to you if they can. Or after you see your GP in the GP session, can you just print out a copy of my files? That may be a couple of reams of paper, okay, but keep all of your information together with you so that when you are going for the next step, you've got it together. Otherwise, people will charge you for your medical records. And then keep that in a notebook or notes app for taking down also what they say as well. So that's what you need as your little checklist. So when I talk about knowing what you want out of an appointment, it may be that, do I want answers? Do I want a referral? Do I want a treatment plan, like a chronic disease management plan or a mental health care plan? Or do I want pain relief today? And being realistic. Okay, so being realistic about what can this individual health professional give me? Asking, am I seeking a diagnosis or a second opinion, or do I want actually someone to listen and guide me? Do you need someone? Are you feeling at the moment like you are just really not sure where to go? So guidance. Are you looking for a different conversation or a different perspective? Okay, looking for a second opinion. So going in there knowing what you are looking for and critically thinking about, what do I want to get out of this? The next question I really love, but it's a hard one, particularly when we're in a lot of pain, a lot of symptoms. We've often forgotten what we feel like if we've disassociated, and we can often feel like we're never going to get there. But please ask yourself, what does feeling better look like to me? It may be that our pain never goes away, but it allows us to get up and put the kids to school or go to work or go to uni or go to school ourselves without the levels of pain that's debilitating. Looking better may feel like feeling or leaving a health professional appointment confident and validated, and you will feel better after that. So write down, what does feeling better look like to you? That's so personal, and that's really the guide. That's your lighthouse section. We want to get back to there. Now, with endo and with pelvic pain, sometimes what I call throwing spaghetti at the wall and seeing what sticks is what happens. So yes, you are the wall and we are throwing spaghetti at you and seeing what sticks and helps improve you to feel better, improves your quality of life. That's difficult and that's a lot to go through, particularly for people with really significant disease and significant symptoms. But it may be that, okay, I have a small increase in my pain or a small increase in my ability. So be realistic. So think about what is important to you and what would feeling better look like for you. So having some clear goals like this will help guide the conversation, and it will help to ensure that your concerns are heard, because you've gone in, you're prepared, and you're thinking, particularly when health professionals can be dismissive, may not have a very big toolbox. So don't have a lot of tools to tap into. Or if I think about the hallway analogy, when we're looking down a hallway, they don't even have a lot of doors to open for you. Okay. I was really surprised, and I will say that there are fabulous GPs in this space. There really, truly are. And I was humbled last Thursday night when we did some GP education, the amount of GPs that come up and said, I really want to learn more about this to help my patients. And they're genuinely often in the space of wanting to help. But I was reminded that they're a generalist. They don't know all of the things unless they specialize in this or have some special interest. And so they often will ask me, well, why would I refer someone to a pelvic health physio? Or why would I refer someone to a psychologist? These are lesions in the body. And what I am constantly reminding them is, no, this is a whole body condition. There are the lesions in the body, but then there are also the symptoms, and particularly our pelvis, which is so intricate and holds so many things in our life. A pelvic health physio can have things like helping you to get your bowel and your bladder moving better, having better sex, having painless sex, having an ability that you can decrease a flare at home or manage that at home. And these are the practical tools that health professionals, like those allied health professionals, is what we call them, can give to patients. And the GP's faces, their jaws just hit the ground. They're like, wow, that's amazing that they can do that. And so they are open to learning if you peel the layers off. And sometimes you will have to do that as a health professional, but as a patient or a consumer to a health professional. But by coming up and sharing that, okay, you don't know everything, health professional, that's a thing, that's okay at the moment. But through my experience, I want to teach you too, or I want to learn as well. Many, many years ago, when we tried to educate GPs, about 10 years ago, no GP would really want to come and listen or educate or learn. So we would have sessions where we would have lunchtime sessions, and we would, buy sushi or put it in the lunchtime room, and no one would ever turn up. And I was on the helpline, the Quendo helpline, and I'd hear from these people who were calling us and saying, this is what my GP said, this is what happened today. And the stories just broke my heart. They still break my heart today. And I see them online being spoken about. And I thought, right, give me that GP's name. Give me the GP's name, and I'm going to go talk to them. So for a long time, I would book in as a patient, and I would sit down and talk to this GP and say, right, you have me for 15 minutes. I don't need anything from you other than to listen to me so I can educate you about endometriosis. So I took our little brochures and I showed them, here's what endometriosis is. Back then it was 1 in 10. And I said to them, you're seeing probably 20 people today, and 1 or 2 of them is going to have endometriosis, and you need to know about it. And so we would almost target these GPs who were not as educated as they needed to be. And that's what we had to do 10 years ago to get them across it. And when they understood the applications and that story that we all have, they're human. They really got it. And they go, oh my gosh, I need to help these people. These days we can pull a room with 80 to 150 GPs and they want to learn, but it's because you're all telling your stories and you're all advocating for yourself, sometimes in a really difficult situation. So keep going. It's making a huge shift. It's really working. But utilizing tools like this will help you to structure what you're saying a lot better and help the GP and the health professional to pick up things. Okay. I want to talk to you about a group of work called Alison Armstrong, and her work is around communication, partnerships, and talking about what you need and speaking up for what you need. She calls this tool the Great Ask, and I'm applying it to healthcare. So she talks about, yes, having the things that you want and you need, but having a clear goal. So it creates healthcare support by giving clarity and safety in conversation. She talks a lot about partnerships, and as health professionals, they're coming into the partnership, they have a role, and so do we as consumers, so do we as the patient, so does we as the person with lived experience. This way of structuring your ask can help provide respect for the health professional's role in their power and in your power. And it helps to build partnerships, not confrontation. And it helps shifting away from what's wrong with me to here's what I actually need from you, and here's what I need to thrive. Here's what I need to improve my quality of life. Here's what I need to help me right now. And so remember that you are the expert in your body, and preparation helps you and your health professionals to work better for the best healthcare. Before we get into that, I want to talk about language tools for talking about chronic pain and endo. So what I would like you to consider is describing the impact that you're experiencing. So by saying that you're in pain, pain means something different to everyone. Okay, so I would like you to consider using these scripts, if I may, ask you to consider shifting your language to describe what's going on for you. And that means describing the impact. So rather than stating your pain out of 10, because 10 for you might be 1 for someone else, and 5 for you might be 7 for someone else. So stating your pain out of 10 is often useless. But what I'd like you to shift in doing is saying, okay, on my worst days, I can't walk without support. Or I miss work and I avoid social outings due to pain and fatigue, and it's becoming worse and worse. Or the pain makes it so hard to concentrate, even on basic tasks. Or when I'm driving and I have an endo flare or an adeno flare, which what I describe as, you know, that Fruit Ninja app where all the fruit's coming down and you've got the knife and you're just boom, 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 and it blows up. That knife and the blowing up often for me can feel like an adenomyosis flare. And it's worse when I'm driving. I don't know why, but it's worse when I'm driving. So I say, on my worst days, I can't drive a couple of kilometers without having something like that happening. Yeah. Be descriptive. Talk about the impacts that it's having with you. If you can drop in the chat, please tell me how would you describe your impacts, or how would you describe those symptoms? So thinking about earlier, the symptoms that we wrote down, if you can just now think about, okay, I'm having these symptoms. These are the impacts that I'm having. So you've got the symptom and then you've got the impact. So we're kind of pulling together some columns here. And if you're open to sharing in the chat, I'd be really appreciative just to give some more examples for people who might be stuck. The other tool I'd like to share with you is using analogies or comparisons. So just like the Fruit Ninja one that I mentioned, it feels like a stabbing or burning pain inside my pelvis, or it feels like I'm having contractions and they don't stop, or deep or dragging ache that radiates down my legs. So use descriptive words, back to primary school. And if you're struggling in these areas, what does that mean? So using the word struggle, again, go deeper, describe the impact. Are your bowel motions too open? Or can you really not pass a bowel motion? Or are you needing to go and do a wee 10 times in an hour? What are those impacts that are having on your day? So start sharing them with me in the chat so I can start pulling out some of those suggestions. And thank you to the people that have already started to do that. So using the analogies like the Fruit Ninja, it gives people a visual of what it might be like if they've used the app, that game. And other people, it's really useful to describe what's happening for you. And then talk about the pattern. So endo, pelvic pain, all symptoms, they start to follow a cycle, or they might have specific triggers. And this can help the health professional and the clinician to connect some of the dots. So the pain starts on a few days before my period and might peak around day 2. And what I say to people is get a calendar, like an actual printed calendar, and start coloring on that what's going on where. That visual can be so interesting and can help you to pick up, particularly in the really busy lives that we live. We can go, okay, well, I've had a really bad flare today, but then it might be okay tomorrow. And then we go along with our life, and then all of a sudden, boom, we're back now, we're having a flare. but it's often a cycle, and it could be triggered by particular things. It might be that you're having a really significant drop in progesterone or estrogen or testosterone, or might be hormonal. It might be there's a really busy period at work where you're writing reports, or end of financial year. I don't know. So think about the pattern that is coming up against you, and you can do that with a visual by printing off a calendar and saying, this is what I'm having, and color code it, showing that to your health professional. You could say, I get sharp, sudden flare-ups that can last for hours, or it's worsening during ovulation and when I'm stressed. And this is giving information about what else is going on in your life. People are saying that it feels like their internal organs are going to fall out. Oh, because your pelvis feels so heavy and inflamed when you get periods. I cannot tell you how many times other people have literally sat on a heat pack. It's like, it just feels like that insane dragging motion and dragging feeling. And sometimes you just straddle a heat pack because what else do you do? Yeah, you've done that too. Yeah. Oh my gosh, it's a thing. I almost posted on social media once, me straddling a heat pack just to help people feel seen, because I didn't know it was a thing until someone in our beautiful Quendo chat, and we have a really awesome community chat. Please reach out to us if you want to join it, where someone had said it, and I thought, oh my gosh, that's just not me, right? That's not just me. So yeah, it can help so much. But think about what's going on for you. Yeah. And then put some words to these invisible symptoms. I really want you to describe, and AI can help with this. Yeah, I'm feeling this, this, and this. Can you use some describing words, or give me some describing words that might help me? And it could just be that when I'm not in visible pain, I'm actually dealing with nausea, brain fog, and fatigue. So those invisible symptoms are becoming more visible. You're describing them. My pain doesn't show on scans, but it's real. Yeah. So the scan, what scan ever shows any sorts of pain, right? Scans are looking at our anatomy. Pain is a totally different ball game. This is a good one. I've learnt to mask it, but it doesn't mean I'm okay. I'll let that sink in. Someone said to me recently, I said to someone that I'm not okay at the moment, I'm having a pain flare, but I had to get up and talk to a heap of GPs. And I had to mask it really well to kind of get the message across and keep going. I'm not advocating to do that, but in that moment I had to. And they said, you hold it all well, you hold it, because I would never know that, because we've learned to mask it, haven't we? We've really learned to mask it. And even though we are masking it, it doesn't mean that we are okay. And as someone says, we're praised to faking it. And sadly, it's all invisible, and we have to mask because otherwise it makes people feel uncomfortable. Yeah, you're completely right. It does, doesn't it? But you can say to people, I've learnt to mask this, but it doesn't mean I'm okay. Yeah, so using invisible words. And I've said that to GPs recently, particularly GPs, because that's where I've done some training. I've delivered training to and education to. And I've told them all, a lot of the people that are sitting across from you have prepared and spent a long time preparing to come and talk to you for that 15 minutes. And they're often doing all of the things and coming and speaking to a GP because they've been so disheartened. Often is the last place they want to be. And same for emergency. We don't want to spend hours in emergency. We go there because we don't know where else to go. And so they're not okay coming in to see you. So please grant them that grace and that respect. I cannot tell you again, the faces in the room were just like, oh, wow, okay. They truly didn't have that understanding. They truly, truly didn't. They seemed really genuinely not understanding that. And that was really surprising to see that reaction. There are definitely other health professionals, individuals that aren't like that, but I was just wanting to describe that a lot of them are genuinely misunderstanding. One of my favorite phrases is, health professionals are not misbehaving, they are misunderstanding. They are misunderstanding you, they are misunderstanding the condition, the impacts, etc. And that's where we have a place to educate them in this space. There's certainly health professionals who are probably misbehaving, but that's not what we're getting into. We want to come from the place of they're truly not understanding me, my values, my goals, my impacts, this condition. Okay, when we come from a place of that, we can actually educate about me, about my goals, about the condition, about my experiences, about my invisible symptoms, and I'm going to describe them to you. And yes, I probably will look fine, like I'm masking it, but doesn't mean I'm okay. I'm incredibly generous. Yes, I know. I'm incredibly generous, and I say that because I've seen lots of different sides of things. Yeah. Okay. So, asking for support for next steps. So using phrases like, I'd like a referral to someone who is in the endo space. Can we create a management plan together that includes things more than just painkillers? Or can we have painkillers being included in that? I need support for mental health as a part of my care. And use the app to track those flare, the mood, the fatigue, and bring that summary to your appointment for the next time with that data. There is a language guide as well with tools, again, that you can use the QR code or head to the website to find it, and it will give you a lot of these prompts to step through. Okay, now going back to Alison Armstrong. So utilising the Alison Armstrong Great Ask in healthcare, it's a framework that helps you speak up and get what you need. And we know that too often in healthcare, we feel dismissed, rushed, or unsure how to ask for the care that we need. And the Great Asks gives us the respectful way to clearly advocate for ourselves without feeling guilt or an apology and actually getting what we need. Okay, so stating what you want. Someone has said in the chat, how do you handle being ignored as a drug seeker in the ED? Yep, absolutely. I'll just make a note of that. Just one moment, make a note of that. Thank you for that really, really good question. It comes up all the time. Okay, thanks, Ash. So first of all, the Great Ask. So this is a structure or a framework that, again, will give you another tool to how to get that ask, how to work out what your ask is. So state what you want, be clear and specific. So it may be that I want to explore options beyond hormonal treatment. I want to explore options beyond a referral to a gynecologist, or I want to explore options to have thoracic endometriosis investigated, or I want to, if you're in an emergency, I want help for the flare that I'm experiencing right now. This is the impacts that I'm having. This is what I have tried. Here's all the tools that I have tried. Here's what worked. Here's what didn't work. And this is why I'm coming to you now, based on all of the things I have tried, to seek additional help, because this is increased in the level of pain. This is increased in the level of symptoms, or I'm getting new symptoms, I'm getting new pain that's in my abdomen and radiating down. So use all of those descriptive words, okay? You can bring in SBAR here, situation, background, your assessment, and your recommendations. That comes into being clear and specific about what you want and what you need. Say why you want it. So if we talk about the whole idea around hormonal treatments, and I say this one because a lot of people ask us, what else is there other than hormonal therapy? So I'm using this as an example. So being specific, I want to explore options beyond hormonal treatment. Say why you want it. So help them understand your why. What is your why behind this? You will know your why because hopefully you've done your values, your goals, your deal breakers, and what you're wanting out of the relationship that we did last week. And you could say something like, because the side effects have impacted my mental health and I want to start feeling like myself again. I know a lot of people, including myself, who have tried hormonal therapies and you just haven't felt like yourself. And you want to do that again, and that's okay. But tell them the why. Why do you want to explore this? Why do you want to explore a new or alternative diagnosis, or explore a new health professional or a new gynecologist? Or I want to explore the options to being referred to a pelvic health physio. Why? Because I'm noticing that I'm having painful sex and I want to enjoy sex. or because I am having issues with my bowel and that's impacting my ability to go to work or go to study, or I'm concerned about pain that's radiating down my legs and I want to do X, Y, and Z, right? Or I just want to feel better. Yeah. So going in, what do you want, and say why you want it. This one's a tricky one. Okay. So you're going to hear this and you're going to initially just disregard it. Okay. But I want you to come back and have another little think about it. I want you to reconsider it. I want you to acknowledge their power to say yes or say no. This is them in the corridor with you saying, yes, I'm going to open that door or not. Okay. And they're often doing that because they have things to consider. It might be a lack of education. It might be a lack of understanding, or it may be a guideline or a medico-legal thing that they're considering. You don't know. All right. But if you're proposing something that they're not familiar with this, the comments are amazing. Thank you for sharing. This is really helpful for me as a presenter. Sorry, just I got sidetracked. They are often or possibly being confronted or challenged by you as a patient. Okay. Yep, that's okay. We can challenge them. We can ask questions. We are allowed to do that. That's in our rights. We can do this. So you can say something like, I understand that you may have clinical guidelines or other limitations, right? So you're acknowledging their position in this partnership. You're trying to build respect. You're trying to be collaborative. Okay, so let's go back to emergency. So going and stating what you want. I know we're running out of time. Just going and stating what you want. I have endometriosis. I'm having a pain flare. I have had a couple of surgeries. They found endometriosis. I'm seeing a pelvic health physio. I'm trying to learn about my pelvis. I'm trying to eat differently. I've had a stressful time. I'm listening to and watching the Manage Endo program. I'm learning how to decrease a flare at home. These are all the things in my toolbox. Here's my paper. Here's all the things I've tried. I have a family history of this. This is what's different now. This is that I'm having an increase in pain. The pain is now radiating down my leg. I'm having, this occur every couple of months or every month, where it's becoming almost every day I'm in pain. Or I can't get out of bed and I've got myself out of bed and I need your help. I need your help because I want to feel myself again and I don't want to be in this amount of pain. Okay, so saying why you want it. I want to feel better and I don't want to be in this amount of pain. And you can say, I understand that this is not a pain management service. I understand this is an emergency department. I understand you have restrictions. I understand that you have limitations. Okay, you're just stating that you understand that. And then I want you to ask for what you want. Okay, so let's actually make the request. You can say, would you be open to referring me to a pelvic pain specialist, the pelvic pain clinic? Would you be open to referring me to the gynecology department? Would you be open to scanning my ovaries to seeing if they've ruptured? Would you be open to looking at the request and the blood tests that I'd like you to do? What do you actually want? Okay. If they say no, you can say, can you help me understand why you cannot do that? If they say, no, I don't know who to send you to, you can say, can I provide some names and suggestions, or can we work through those different referrals together? If it's an emergency, like I said, can you help me understand why you cannot do that? Or what part of my story has you concerned and therefore not able to give me what I've asked you to do or asked of you? The term, can you help me understand, can be so powerful. It comes from a place of, I genuinely want to understand your perspective here. Okay, and that's collaboration and that's respect, that's building there. You can say, all right, well, what are the risks to that and what are the benefits to that? And one of my favorite lines that I'd encourage you to use, if they decline your opportunity for a referral, for a blood test, for a scan, etc., you can say to them, I understand that's your perspective. Can you please write in my notes that I have requested the actual request, X, Y, and Z, and that has been declined. Can you please pop that in my notes? Can you please write that in my medical records so I have a time in which I can refer back to? They won't do it, or they will just give you whatever you want. But they're very reluctant to do that. And if you show them this partnership and you show them this problem solving that you have been trying to do from your perspective, can be really beneficial and really helpful. But it's a hard thing to do, and it is confronting to do. And this is literally how you can advocate for yourself in these situations where you have power, where you have a proactive approach, a solutions focused approach. And then show gratitude. Regardless of the outcome, regardless of the answer, grace and gratitude can go a long way. You can say something like as simple as, thank you for considering it. With your GP, you know, if you're shifting different options, thank you for speaking with me today. Thank you for letting me talk to you about it. For an ED physician or ED guy, doctor or nurse, thank you for considering my request. Yeah, it's a request at this stage. So I hope that gives you some structure there, because it can be really powerful. And so it could be that I want to understand all my options for managing endo pain because I've tried many treatments with limited relief. I know you may have time constraints or treatment protocols to follow. Would you be open to working together on a plan that includes both medical or non-medical options, or that includes pain relief now and a referral to a pain specialist or a pain clinic or a physiotherapist? So you're advocating for what you need right now, but you have the next step, particularly if you're going to emergency with pain. And thank you for listening. It just makes a difference to actually be heard. Okay. And so someone has popped in the chat that they like to say, is this something you can help me with? Oh, what a good one. So saying to the health professional, here's my request. So going back to this one here, here's my request. Is this something that you can actually help me with? Right? That's so good. Thank you for contributing that. And the best advice the psychologist gave someone was to come from a place of curiosity and not judgment and defensiveness. Yes. If you can see the sign here behind me, I don't know if you can see that, it says stay curious. Stay curious. This is a reminder for me all the time. I get challenged a lot, but I have to stay curious. And it's hard when you're in a pain flare and you need help. Okay, I acknowledge it's a lot to ask, but I also promise it will help you so much to approach it like this. If you can, very quickly, we're about to wrap up. We have a poll workshop there, and I would really love if you can just share some feedback around if this was helpful or not as we finalize here. So there's some examples there. And then there's also the rights that we spoke through, the interpreter options, the option to have a family or friend. It's okay to request a specific healthcare professional or gender. And particularly with interpreters or in writing, you can say things like, I have ongoing pain and I need help managing it. Or I think I have endometriosis. Can I see a specialist? Or I feel dismissed and understood. Can we talk about this again? And it may be that you say, I'm feeling dismissed and misunderstood. Can I have 5 minutes, or can I come and see you next week? And also preferring a female doctor if that's available. There is again another guide there for healthcare conversations if English language is a second language to you, and it can feel really overwhelming and unfamiliar, but you are not alone, and we actually have incredible mentors in this space who we can connect you with to talk you through it. There's some conversation starters here. So if you're asking for a referral, something like, I'd like to be referred to a specialist who understands endo, can you help me with that? If you feel dismissed, saying something like, I know something doesn't feel right. Can we look at other next steps or other possible causes? So simply stating, something doesn't feel right, something's not fitting right with me. If you're requesting a female doctor, you could say for personal reasons, I would like or to prefer a female doctor for this examination if possible. You don't need to tell them what the personal reasons are. Asking about treatment options, again, what are the benefits and the risks? Is there anything other options we could try first? This was one from someone who identified as First Nations, was a First Nations woman, and she shared this with her elder. And they said something, I know this might not be something we usually talk about, and I really respect our values, but I've been in a lot of pain during my period, and it would mean a lot if we could talk about it, even just a little. So that's what they suggested. And asking for a break of clarification. So it can be really overwhelming. Yeah, it's a lot of info to take in. So by saying, I'm feeling really overwhelmed right now and I need to pause for a moment, can you explain the terms in simpler terms? Can be really helpful. Having, again, navigating that template, that plan here, utilizing all of the tools that we've went through here. And there's a great template on the website there too that we can send around that has all of those different tools and strategies, but it also is in the app. And like we've said, think about your goals, what your values are, what's not a value, and what your deal breakers. We need this multidisciplinary team around us. There are so many management options that you have, but you need to identify the symptoms first and start from there. Know all of these people you can be referred to yourself or go and see them as well, and then work out against your symptoms who might help you with those. You need to build the team. This is a team approach. Build your village and interview them. Yeah, interview that team. You choose who you bring on that team. You've got lots of different options, psychology and counselling, pelvic pain, etc. And the fundamentals of which is what we've spoken about. We're building two-way trust, ongoing relationship. This has mutual respect. There's common purpose. You have shared trust and aligned expectations with your healthcare team. And at the end of the day, if another person who is around you doesn't really know where to even start, you can simply say, as a tool, they could ask you, do you need support right now or do you need suggestions? Do you need support right now for holding space, holding that space for you just to sit with you? Or do you actually need suggestions? Do we need to start pulling things in from the toolbox? Do we need to know where the heat pack is? Can I get you something? That's what suggestions look like. Whereas support sits there, let's hold space for you. Tell me, talk to me about what's going on. And offering no suggestions, just holding that space. So utilizing the app is there. It's so exciting to have an upgrade, so stay tuned for that one as well. You can share a report with your emergency department. It's so great to have this because you can put in all of your different plans, all the things that's going on for you. And if you do go to emergency, you can share a report, which is a snapshot of all the things that you have been going on, all the different medications and known conditions that you're experiencing. So if you're not well enough, just send this to them to try and communicate for you. If you are supporting someone as a partner, educate yourself. This is chronic, it's long term, and have that active listening. The support or suggestions question is brilliant. Encourage connections. We often push people away, even the ones we love the most, and seek your own support as well as a partner. And we have incredible partners that are very, very keen to chat with you. Some practical support options is things like meal planning, knowing where the heat packs are, knowing what setting on the microwave we like our heat packs. I'd love to know what setting you all are in the chats. I'm definitely a 3-minute person for my heat pack, for the Willy heat packs that we have on the Qendo website. So tell me how many minutes you like your heat pack for. But knowing those settings makes a big difference. Encouraging movement. How can your partner share the mental load? Seeking support and symptom tracking. And if you are a parent, all of the above, plus talking to schools and regular check-ins. That communication with the school can be super helpful for that child's education. Participating and getting them involved in different things, and you can connect them again with our mentors and we can really help them along. At Qendo, we have what I call an ecosystem of support. All of these things are available to you and they are free. So we have our helpline, we have our mentor program, our app, we've got support guides for workplaces, there's resources there, there's workshops, the Manage Endo course. Online, we have our wonderful nurse Jill who is available and here to talk with you and how to implement all of these things. There's national resource guides that we give to GPs. We give them to hundreds of GPs every year, and it talks them through how to guide someone through with endo, and you can get a copy of it from the website. And the care is here. So what we say is whilst there's no cure, there is care. And if you need some support to implement what we've talked about, click the QR code, scan the QR code, or go to quendo.org.au/Quendo Care, and you can book directly in with our incredible nurse Jill, who will hold that space for you, talk you through, but then actually work out those next steps with you and keep checking back in with you. So we're here to see where you are at and then walk you along the next steps, because we all need space for that. The next steps, like I said, connecting with one of these services, and we will be building out the health literacy platform as well. But we are here to support you in any way possible. Thank you again so much for joining us across these webinars. The mentor program is opening currently, so you can scan to register to be a mentor or a mentee, and we will work with you one-on-one through 6 weeks, utilising the Quendo app like we've talked about. And if you do have CPD points and you have been here as a health professional, please reference this code. That is it for our final webinar in these series on how to advocate for yourself in the healthcare system. I would thank you all so much for your kindness and also patience while I went very over time, but I really do hope that you have found tools that have been helpful. We'll open it up for a very short Q&A. Ash, if you want to go through any of those, or if you'd like to pop them in the chat.
Absolutely. We have the one from earlier about how do you handle being ignored as a drug seeker in the ED?
Yeah, it's tricky, right? And so as a drug seeker, it's such an inflammatory word, isn't it? It's so horrible. But I totally agree with you, and have heard it myself. I worked in Queensland Health for a number of years, and I heard people say that. I would challenge it. Yeah, I would challenge it and say, I don't have a history of abuse. I have a chronic condition that requires management and requires support. And here's all the things that I've tried to do. A lot of it's in how you approach those conversations. So you're currently not in emergency at the moment, I don't think. I wouldn't assume so. How you go into that conversation will make or break it. So utilize these tools that we've talked about, going in knowing all of the things. And if you can show them all of the things that you've tried to give and tried to do before you got to this point, and educating them and communicating them on that, I know, and I think, and I know it will go a long way. Okay. It'll go a really long way in how you set that up, how you set up that, that engagement. So if you are, I'll just go back to here, if you are coming up against that, please think about how you approach it next time. Get prepared whilst you're not in a flare. Get prepared with all of this stuff while you're not needing that service. And then when you go into that service, you can say things like, here's all of the things I've tried. This is increasing. And like I said earlier about the big ask, utilizing those next steps. I know there are restrictions around this, particularly for opioids. I know there needs to be careful consideration. I need help right now because the pain I'm in is new and it's significant and it's consuming and overwhelming, and I don't know what else to do. Will you help? Can you help me? As someone said, is this something you can help me with now? And then think about the next step. Okay, I want you to think about the next step. Ash.
That's it. We have everybody.
I think there's one more come through in the chat though.
Oh, yes. I keep trying to educate ED staff not to give me pain relief from certain classes of drugs because she doesn't metabolize them very well and usually has quite severe side effects.
Okay. Really, really good question. And so I would again keep a list. Oh, such a good question. I would keep a list of what those particular drug classes are. And just like when they say to you, are you allergic to anything? And they'll often, particularly in emergency, they'll give you the red, the red tag. You can say to them, and have this in your documentation already, have it as a part of that care plan. Here are the classes of drugs that I cannot access, that I can't have pain relief for. And here is my allergy. They'll often say, what was your reaction? So also be prepared for that. So for me, I can't have morphine. which sucks. But I can't have morphine and or the active ingredient in morphine, and it gives me hives. So I'm prepared to tell them what happens to me. And so they give me the red tag, and then what that does, because it's ingrained in their processes, which is a good thing, every time they go to give you something or check something, they see the red tag on your hand or your ankle and go, oh, okay, trigger for the health professional, something's going on here, I need to check. They need to check it. So that's where you can say, these are the classes of active ingredients or drugs that I cannot have, and these are the impacts that I have. It's a good question, but you've got to go in prepared again and get ready to say, I have an allergy here. Okay, I do it every time and have done for a long time. But they've been very, very understanding, and against we've trained people in that. Okay, amazing questions. You are all amazing. Thank you for coming and being willing to learn. I know I challenged you in a lot of ways, and I do so with kindness and significant care, because I really want you to get the best out of this healthcare system. But we are here. Call us if you need help. Call us if you need navigation support. If you need to see a pelvic health physio, a psychologist, counsellor, or dietitian or nurse, and you cannot access them currently, please email us. Can you please contact us? That's your homework, as well as all of the things. We want to help you in that space, and we can very, very soon. So that's info@quendo.org.au if you need to access those services and you cannot because of financial reasons or whatever. As someone said, and as a closing comment, someone said in the chat, we can't change without challenging our current methods. So if things haven't been working for you, we need to challenge that. And I hope that you've felt supported, seen, and really considered in that process. Thank you all so much. Have a great evening. And I look forward to checking in with you and connecting with you soon. See ya.